This is our case study on a patient who presents with alcoholism.
This is a 52-year-old Caucasian male construction worker who presents as a new patient. He is 5 feet 10 inches tall and weighs 250 pounds. His vital signs are as follows: blood pressure 138/88, pulse rate 90 beats per minute, respiration 24 breaths per minute, temperature 98.5 Fahrenheit, and oxygen saturation is 98%. The patient's chief complaint is, my wife noticed 2 bumps on the sides of my face and she's worried. The patient has a history of heavy alcohol consumption, 8 to 10 drinks daily for over 20 years, and tobacco use. He is currently taking calcium carbonate and has a history of non-compliance with both medical and dental appointments. Upon completing the extraoral examination, the patient presented with bilateral painless enlargement of the parotid glands with non-associated symptoms such as redness, fever, or weight loss. A clinical photograph was taken. The intraoral examination also revealed signs of xerostomia, which may be linked to his chronic alcohol use. During the review of his medical and dental history, the following conditions were noted and should be addressed: high blood pressure, anemia, malnutrition, persistent heartburn, hepatitis, jaundice, or liver disease, and snowing. He is classified as ASA2.
The signs and symptoms the patient presents with are spider angiomas, erosion on the lingual surfaces of his anterior teeth, xerostomia, glossitis, loss of papillae, malnutrition, and bilateral painless enlargement of the parotid glands.
The treatment and dental management include performing a comprehensive oral examination and obtaining a detailed medical and dental history, including cannabis use. Emphasis to be placed on the importance of effective self-care, regular dental visits, and the use of topical fluoride to prevent caries, while advising healthier snack options over carcinogenic food. Xerostomia management should be initiated with recommendation to avoid alcohol-containing products. Alcohol-related concerns should be addressed through education on the impact of alcohol on oral health, including increased risk for oral cancer and bleeding, and brief interventions using alcohol screening tools like the AUDIT or CAGE questionnaires. Referral to appropriate treatment programs may be necessary, and consultation with the patient's primary care physician is advised. For pain and anxiety control, nitrous oxide sedation should be used with careful monitoring, and epinephrine use should be limited. Increased vigilance is required for bleeding tendency and unpredictable drug metabolism, as well as avoiding psychoactive drugs and alcohol-containing medication to reduce the risk of relapse.
Alcohol can alter the absorption and metabolism of a medication and vice versa. It can also alter the pharmacological effects of a medication, increasing or decreasing the effects of the medication on the body. Benzodiazepines can increase risk of death and injury. Antidepressants may increase effects on the central nervous system. Anticoagulants and cardiovascular medications can increase bleeding risk, elevate blood alcohol, and lower blood pressure. Opioids can cause respiratory suppression and overdose. NSAIDs and amphetamine can cause liver damage and gastrointestinal bleeding, and microbials can cause reduced efficacy, liver toxicity, and flushing reactions. Alcohol-dependent treatment medications can include disulfiram, naltrexone, and acamprosate. Our patient management will include maintaining a positive attitude, free of judgment, so that the patient feels comfortable, maintaining confidentiality, and keeping the patient's appointments short to reduce anxiety. Special precautions include making sure to check for bleeding tendencies, careful selections of medications and anesthetic due to unpredictable metabolism of drugs, increased risk of infection, and increased risk of erosion due to acidity of alcohol and increased vomiting.
Question time. Question 1. What is one oral sign or symptom commonly observed in the patient with alcohol use disorder? Question 2. What are special precautions to consider for patients with alcohol use disorder?
The answer to question number 1 is xerostomia. The answer to question number 2 is making sure to check for bleeding tendencies, drug interactions with alcohol, and being cautious with the increased risk of infection and erosion. These are our references. Thank you so much for watching.